Hello, everyone. Thank you for joining us for Arthritis Talks, Fibromyalgia and Arthritis. I'm Dr. Sean Bevan, Chief Science Officer at Arthritis Society Canada. First, while we've come together for this event from many different places, I want to acknowledge the land on which I am located on and on which our Toronto office stands. This is the traditional territories of the Mississauga of the Credit First Nation, Anishinaabeg, Huron-Wendat, and Haudenosaunee Indigenous peoples. Today, this place is home to many First Nations, Inuit, and Métis people, and I am very grateful to have the opportunity to work and live with my family on this land. Now, fibromyalgia is more common than you might think. It affects between 20 to 50% of those living with inflammatory arthritis. The widespread pain, fatigue, and sleep problems that are common for those who have fibromyalgia can be particularly challenging. Now, tonight, we are very fortunate to be joined by physiotherapist Cynthia Roberts and occupational therapist Kristen Dillon, who both work for our Arthritis Rehabilitation and Education program. Cynthia and Kristen will share their knowledge and expertise on how to manage fibromyalgia and arthritis. Before we get started, just a few logistics. This webinar is best viewed on a laptop or desktop computer. If you experience technical difficulties, please email arthritistalks@arthritis.ca for assistance. If you have a question for our presenters, you can submit it through the Q&A button, not in the chat, at the bottom middle of the screen, and we'll try to get to as many questions as possible during the hour that we have together. You can click on the chat icon also in the bottom middle of the screen to access the chat and connect with others and our chat moderator. Now, if you find that distracting, you can close out of the chat completely. Just click the X icon to exit the window. And to enable closed captioning, please click on the Show Captioning icon in your Controls toolbar at the bottom of the screen. So many questions we received in advance did follow similar themes, so we're going to get to those first before going into the live Q&A at the end of the session. But before we begin, I want to thank our event partners, including Pfizer and others, for their financial support of our Arthritis Talk series. Now, with that, let's get started. And first, a very, very warm welcome to today's experts, Cynthia and Kristen, who are joining us from Ontario. Kristen, can we start with you, please? And wondering if you could walk us through how is fibromyalgia diagnosed?
Thank you. So the diagnostic criteria for fibromyalgia was recently updated in 2019. And the newest set of criteria has simplified the diagnosis process. And fibromyalgia is no longer considered a diagnosis of exclusion, but rather a condition that can be positively diagnosed by the primary health physician after careful consideration of your history and symptoms, and as well examination. So the 2019 diagnostic criteria are evident on this slide here. The first part is that what is required is multi-site pain in 6 out of 9 regions in the body. And you can see from the picture of the body with the blue circles represent the 9 areas of the body. There is the head, the chest, the torso, the upper and lower back, and then the arms, front and back. The second criteria is moderate to severe sleep and fatigue problems. And the fatigue problem might be physical fatigue, but it also could represent mental or cognitive fatigue, which some people refer to as brain fog or even fibro fog. And importantly, these symptoms must be present for at least 6 months' time. It can't be something that's short term. And in addition to this criteria, people with fibromyalgia might have other symptoms like gastrointestinal symptoms, bladder problems, weakness, or headaches. So I want to talk about the different types of pain. And it is now recognized that there's actually 3 distinct types of pain. The first type of pain is the type of pain that people most commonly think of when they describe pain, and that's nociceptive pain. And this is the pain that you get when your body and nerves detect a harmful stimulus or tissue damage. So think about things like broken bones or even osteoarthritis. The second type of pain is neuropathic pain, and that's pain that involves an injury or disease that affects the nerves. And that includes things like carpal tunnel syndrome or even sciatica. The third type of pain is described as nociplastic pain. And this is the type of pain that is involved in fibromyalgia. It arises from the altered transmission of pain messages through the nervous system that result in a fired up nervous system. Now, you can have more than one type of pain. So, for example, you might have osteoarthritis, which causes you nociceptive pain. And that osteoarthritis, for example, in your spine might contribute to a sciatica, which would involve neuropathic pain. And all of these pain symptoms might be amplified due to nociplastic pain. When you have fibromyalgia and nociplastic pain, you sometimes have hypersensitivity to other stimuli, so such as sounds or smells, medications, touch, and light. Functional MRI, which is an MRI machine that they use for research purposes, it shows that there are actual changes in the brain to people who have fibromyalgia. So, for example, the areas of the brain that are sensitive to pain might be larger, they might be more interconnected. And we also know that neurotransmitters or hormones involved in the communication of pain signals might be altered. And they might be in greater numbers or lesser numbers. All of these changes, the brain, the neurotransmitters, for example, result in the volume being turned up on your pain. So, who's at risk for getting fibromyalgia? First of all, we know that it affects about 2% of Canadians. It affects 80 to 90% of women. So it happens more often with women, but men can also get fibromyalgia. It can occur at any age and even affects children and teenagers. And as Sean noted in the introduction, people with other rheumatic diseases such as rheumatoid arthritis or lupus or ankylosing spondylitis might also have fibromyalgia. Now, people with fibromyalgia may have a history of physical, emotional trauma, and this trauma may have started in childhood. Sometimes fibromyalgia occurs after an incident or accident, such as surgery, broken bones, or infection. And having a relative who has fibromyalgia may make you more likely to get fibromyalgia yourself. So, fibromyalgia isn't officially considered a form of arthritis because it doesn't cause damage to the joints or muscles, but it does have some symptoms in common with arthritis. And as we noted before, you can have fibromyalgia and another rheumatologic condition. So now that I talked about what fibromyalgia is and what the diagnostic criteria and symptoms are, I wanted to talk to you a bit more about the difference between fibro and types of arthritis. So on the slide that you're seeing now, the orange squares or circles represent systemic inflammatory or autoimmune arthritis. One of the most common types is rheumatoid arthritis. This type of arthritis affects the joint lining and causes inflammation. And if it's left untreated, it can cause damage to the joint and the bones and even affect the organs. Um, it's very important that people with inflammatory arthritis are seen by a rheumatologist, and they may need to be put on disease modifying medication to control the inflammation and prevent joint and organ damage. The blue circles and squares represent those joints more commonly affected by osteoarthritis. They tend to be weight-bearing joints, things like hips, knees, spine, but also the base of the thumb, the smaller joints of the fingers, the big toes. Osteoarthritis is described as the body's failed attempt to repair damaged tissues in the joint. We know now that osteoarthritis affects more than just the cartilage. It can lead to the breakdown of cartilage and even possibly the underlying bone and supporting structures. All right, I'm going to pass it back to Sean now.
Thank you for all that great information, Kristen. Cynthia, let's turn it over to you now. So what can be done to manage fibromyalgia?
Thank you, Sean. I'm really excited to be here tonight and talk about this really important topic. So the best practice guidelines for the treatment of fibromyalgia advocate for a multimodal self-management approach. Because fibromyalgia is predominantly nociplastic pain, as Kristen explained to us, the goal of many of the management strategies is to turn down the volume on the pain amplification systems and to turn up the volume on the pain dampening symptoms. The image on your screen shows some of the factors that can prolong and amplify your pain, and they all feed into one another. For example, pain from fibromyalgia can disturb your sleep. And if you don't sleep well, the fatigue you feel during the day can result in frustration and stress that you can't do what you need to do, maybe some fear of the future. And all of that can affect your mood. And when you're feeling low, you feel more tired and less inclined to exercise. It becomes a bit of a vicious cycle. In addition, for people with fibromyalgia, they may have multiple sites of pain and past negative experiences with trying to exercise or address their pain in other ways. And all of these factors can make your pain feel worse, leading to further pain sensitization. If you are able to break the cycle by addressing even one or two of the factors, it may be possible to achieve some reduction in pain and improvement in function. One of the biggest strategies that can address almost all of the factors in the pain cycle is physical activity. Now, research tells us that a graded exercise program is an important part of fibromyalgia treatment. In fact, the Canadian guidelines for the diagnosis and management of fibromyalgia state that regular physical activity should form the cornerstone of treatment. Other research tells us that it is okay to do moderate and even vigorous exercise, including muscle strengthening and resistance work, but people with fibromyalgia must progress slowly and monitor their response to exercise. Now, exercise may help interrupt the pain cycle by improving overall muscle condition, improving deep sleep, release of the feel-good endorphins in the nervous system and blocking pain signals to the brain, and improving mood and sense of well-being. And not only can exercise help fibromyalgia, but exercise is also one of the most beneficial treatments for arthritis. Now, physical activity and exercise may initially result in increasing pain as your tissues and nervous system adapt to this new stimulus. You will want to find your just right challenge, not too much, not too little, and always start low and go slow. Now, the key to incorporating exercise and movement into your daily routine is to find activities that you enjoy and that work for your body. There are various forms of exercise like stretching, strengthening, cardiovascular, and balance exercise, and each one has an important purpose. For example, flexibility exercises work to keep our joints and muscles moving well. Resistance training, such as lifting weights or using exercise bands, aims to increase the strength of our muscles. Cardiovascular exercise, such as walking or swimming, helps to strengthen our lungs and our heart. And many of these forms of exercise can be incorporated into a water-based program, a home-based program, or group exercise program, depending on availability and your interests. Now, experts agree that water-based programs are really well tolerated for people with fibromyalgia as well as arthritis, and studies have shown them to improve pain, fatigue, and quality of life for those with fibromyalgia as well as arthritis. Walking programs are also an excellent way to participate in regular physical activity and can help with posture, reduce the risk of osteoporosis, and it's convenient because it can be done almost anywhere. Now, you can modify a walking program by using walking poles, which may help to offload any joints that might be sore from arthritis. And those walking poles also help to promote a good posture and also upper body strengthening at the same time. It is best to approach any new exercise program, whether it's walking or water exercise, by starting slowly, monitoring your symptoms, and modifying your program as needed by reducing repetitions or duration. Make any increases to your program slowly, no more than once per week. Another great tip is to start with a little less than what you can do right now and aim to do that on a consistent basis. For example, if you can do 10 minutes of walking right now, maybe try starting with 5 minutes, but do it every other day, building up gradually to doing it every day. And once you've succeeded, you can gradually add time to your walks minute by minute. Now, the guidelines for all adult Canadians is to aim for 150 minutes per week of cardiovascular exercise. And that may seem like a bit of a lofty goal, but just remember that is a goal and it's not where you're going to start from. So always start low with a manageable amount and gradually work your way up towards that goal. Now, I also want to mention mind-body exercise such as yoga and Tai Chi, because these can be especially helpful for people with fibromyalgia. One study demonstrated that Tai Chi appears as effective for managing fibromyalgia as cardiovascular exercise. And this study also demonstrated that Tai Chi had other positive effects on anxiety, self-efficacy, and coping skills. Now, I do want to look at some specific exercises that somebody with fibromyalgia could do. Just remember, everybody is individual. These are just meant to be some examples, but you should always seek some advice from your healthcare provider as to what is the right type of exercise for you. So we've got on the screen some beginner exercises or lower intensity exercises that could be done during a flare-up of your fibromyalgia or your arthritis. So first of all, we have gentle range of motion exercise. So this involves moving each joint slowly back and forth, not forcing it, just oiling up or lubricating the joints. So you can see in that video, it's the knee that's bending up and down. You want to aim for 5 to 10 repetitions and complete 1 to 3 times daily. You can apply heat prior to range of motion to help with any stiffness. The next thing you might want to try is some low impact cardio. So here you could consider things with little to no resistance, such as stationary cycling with no resistance, or maybe water walking. And if you're in the midst of a flare-up, you might just want to aim for 5 or 10 minutes daily so as not to overdo it. The third type of exercise you could try would be breathing exercises. Now, these can be really helpful for calming the nervous system, which can help to dampen the pain signals. You want to aim for nice deep breaths, breathing into your belly and expanding the rib cage, and then really focusing on a nice long and slow exhalation, which is the part of the breathing that can really help to calm down that nervous system. And just doing 5 nice deep diaphragmatic or belly breaths can be really helpful for managing that pain. Now, the fourth type of exercise you can do in these in the midst of a flare-up would be some isometric strengthening. So with this type of exercise, you're gently engaging or tensing the muscles without actually moving the joints. So it tends to be better tolerated than other types of strengthening. So in the example that you see on the screen, you could be lying on your back and use your other arm as a blocker from letting the other arm move. So you're trying to pull the arm inwards and the other hand is blocking the movement, and the two are kind of fighting against one another. You can hold that for 5 or 10 seconds and repeat a couple of times. There we go. So now we're going to move on to some intermediate or moderate intensity exercises. So maybe you're coming out of a flare-up and feeling a little bit better. So at this point, we can do things that are a little bit harder, things like maybe stretching some of those tight muscles. So the first exercise we see here is a great stretch for the back of the thigh. And it's just one example of things that could be done. So you could be sitting on the edge of your chair and holding a stretch for about 20 or 30 seconds, repeating 2 or 3 times just by simply leaning forwards until you feel that pull down the back of the leg. So on the edge of the chair, one knee straight, leg out in front of you, leaning forwards till you feel the pull, hold for 20 or 30 seconds, repeat a couple of times. That's just one example of a muscle stretch that could be done. Now you could also at this stage of the game try some light isotonic strengthening. Now isotonic means that you are contracting or squeezing a muscle while now adding movement to it. So in this example, we've got an elastic band around the ankle and a chair leg and actually straightening the knee against the resistance of that band. We would want to start with light things like an elastic band or maybe just gravity as resistance without the band. Repeating maybe 8 to 12 times, doing a couple of sets every other day or 2 or 3 times per week is a good way to start. And then the last thing you might want to do in this stage is to progress that cardiovascular exercise. So you might want to try increasing your tolerance for a little bit more weight-bearing cardiovascular exercise while still keeping it lower impact. So maybe walking with poles, again, for 10 to 15 minutes, or maybe stationary cycling with a little bit more resistance. Now, moving on to our more advanced exercises. So again, over time, you can work your way up to the point where you're doing greater resistance on your isotonic exercises. So maybe you're using body weight as resistance. As in this example, you're actually standing up out of the chair and then controlling yourself back down again. You, again, could do 8 to 12 repetitions or build up to that, 2 or 3 sets every other day or 2 or 3 times per week. The other thing you could do is add some weight or greater weight to your isotonic strengthening. So here we see an upper body exercise using weights above our head. Now, obviously, this is something you'd build up to slowly. This isn't something you would jump into right away, and always starting with lower weights and gradually increasing. And then finally, you can progress your cardiovascular exercise. So try walking for longer periods of time or at a faster pace. Maybe other forms of moderate impact cardiovascular exercise would be okay at this stage as well within your tolerance. And remember that ultimate goal is to get up to about 150 minutes per week in total. Now, many people with fibromyalgia and arthritis pain may be concerned based on previous experience that exercise may worsen their pain. And our advice is always to start low and go slow. One way to minimize pain and maximize results is to keep track of what exercise you do, for example, in a diary or maybe in your smartphone app, as well as your pain and fatigue ratings. It is normal to feel some discomfort when you start a new exercise program, but this does not mean that you're causing harm. If exercise worsens your baseline level of pain for more than 24 hours after exercising, you could consider modifying rather than stopping the exercise completely. And always seek help whenever possible from professionals trained in exercise prescription. Many times the trick is to find the just right dosage of exercise for you. Now, I also want to emphasize that you need to make sure you consider what you are wearing on your feet when you're exercising. Supportive footwear can really optimize the alignment of not only your feet and your ankles, but also your knees, your hips, and your spine. And this can help improve pain when standing and walking. At the same time, footwear is not just for exercise. The most important time to use supportive shoes is when you are on your feet for longer, for example, when you're walking outdoors. But don't forget about indoors. If you will be on your feet for any length of time, maybe you're cooking in the kitchen and making a big meal, or maybe you're cleaning and spending half an hour to an hour on your feet, you should have something cushioned and supportive on your feet, even if you're indoors. It doesn't have to be a full running shoe, but something that has even just a few of the features that are listed on the screen. And last but not least, good posture is a Really important part of the foundation of fibromyalgia management, not just when you're exercising, but really all day long. Strong posture can have an influence on reducing pain and stiffness, especially in the neck and the back, preventing muscle spasm, reducing pressure over bony prominences, especially when you're sitting and lying, and improving your breathing capacity. With all that being said, perfect posture is not very realistic for most people. Everybody's anatomy is different. We each strive to support our spine in the most comfortable position we can maintain. In addition, I generally advise people to be moving and adjusting their position frequently throughout the day. In fact, the best posture is a changing posture. I recommend you change up your position or activity every 20 to 30 minutes. You might want to set a timer. You could use your smartwatch for an alert, or maybe your activity may cue you. You might say to yourself, I'm going to sit down to peel the potatoes and then stand up to chop them. Your ability or inability to maintain a posture can also be a cue that you need to switch it up. For example, if you're starting to slouch while you're watching TV, then you know it's time to stand up and move around. And keep in mind that a break doesn't need to mean relaxing and doing nothing. You can take a break from sitting by doing something in standing, or you could take a break from a physical task to a more thinking or cognitive task. The bottom line is try to be mindful of your posture, not just during exercise, but really all day long, and switch it up frequently.
Okay, there were so many great recommendations in there, Cynthia. Thank you so much. And we've seen that pain cycle before, so we know how important that is. Now, staying on the topic of recommendations, we know that fatigue can be particularly challenging for people with fibromyalgia. So, Kristen, if I could turn it back over to you, do you have any recommendations on managing fatigue?
Yes, thanks, Sean. So in the program that I work at Arthritis Society, we often refer to the 5 Ps. And these 5 Ps are good to consider each category when you're having either high fatigue or high pain when doing an activity. So the first thing is you're looking at problem solving. So if you notice that a particular task, and everyone might want to just think now, is there something particular that's really difficult for you to do? Could you do it in a different way? Is there a different position, maybe a different device, maybe getting help, or breaking it down into manageable parts would make you still able to do that task, just differently. Planning is very important with fibromyalgia, in that you want to look at planning both during the day and also over the week. So you want to look at what tasks are the most demanding for you and how could you best space them out so that you're not doing too many of those intense tasks at the same time. Prioritizing involves thinking about what actually needs to be done, by whom and when. So sometimes the task needs to be done, but it doesn't have to be done all by you. It can help to make a list of what you need to do. Some of my clients with fibromyalgia will make a daily list and put at the top of the list the things that are most important and have to get done. The other tasks may or may not get done that day or may not get done by you. Pacing is probably one of the most important of the 5 Ps, and that involves looking at how you can break a task down into smaller pieces and spread it throughout the day or the week. But it also involves taking regular rest breaks before you get tired. So often when you have fibro, you might need to rest up before the task, rest up in between the task, and even take a small rest break after the task. And finally, posture, as Cynthia mentioned, it's really important to consider how you're holding your body during an activity, especially as it relates to what postures and positions are more comfortable for you. And to try to maintain an upright posture, because when we slump, it does take additional strain on the muscles and additional energy. So you want to think about trying to lengthen and be upright And that might mean that you have to use, for example, a pillow or some sort of tool to help you maintain your posture. When we talk about fatigue management, I like to use the spoon theory as a way to describe the limited amount of physical and mental energy that people with chronic health conditions like arthritis and fibromyalgia have. Christine Miserandino is a health blogger, and she coined this term. And when she was out for a meal with her friends, she asked them to all give her their spoons. And she held the spoons in her hand and said, "This is all the energy that I have for today. It's in these spoons." And just doing some simple tasks is taking away the spoons. And by the end of her explanation of all the tasks she had to do, she was left with no spoons. So the graphic here on your slide shows how some tasks may take more spoons than others. And this is different for everyone, and it could fluctuate throughout the day, the week, or your condition. And there are some activities, for example, graded exercise or pleasant social interactions that might give you back spoons. The key is to analyze how much energy you have available to you each day and what activities you're willing to give spoons to. And one of the greatest aspects of this theory is that it's self-forgiving and you're in control of how you spend your energy. Another important element to consider that we've mentioned a couple times as it relates to exercise, for example, is tracking. And what you see on this slide is the Arthritis Society's symptom tracker tool. And this tool, which is available on our website, helps you to track some key factors for your condition. For example, your pain, what the score of the pain is morning, afternoon, evening, where it is in the body, but it also looks at things such as fatigue, mood, stress, exercise, healthy eating, and social. Once you complete the tracker, and you don't have to use the tracker, you could also, for example, use a journal, or there's many apps available to do this sort of tracking. You get a better understanding of where your spoons and energy are being used, and then that might help you plan for future so you don't have as high fatigue or pain. And finally, it gives you some good information to share with your healthcare providers as well, like some actual data. When we talk about fatigue management, we need to talk about sleep. And we know, as per the diagnostic criteria, that many people with fibromyalgia have disturbed sleep. And the 2019 fibromyalgia diagnostic criteria includes disturbed sleep, which we think might be a result of the nervous system changes in people with fibromyalgia and possibly the abnormal neurotransmitters, specifically serotonin levels or substance P. We spend a third of our life sleeping. We need sleep for our immune system. We need it for memory, learning, concentration. And when we sleep poorly, our pain threshold can be lower. And some research even points to having higher inflammatory factors when sleep is impaired. So considering strategies to improve sleep, we want to first look at the basics. And are we practicing healthy sleep habits? So some of these things include avoiding large meals, smoking nicotine, drinks that contain caffeine, and late night exercise. So the exercise, the smoking, and the drinks that contain caffeine, we want to avoid that after 4 o'clock. And we also want to avoid using screens with blue light right before we go to sleep. Building the sleep drive is very important, and this involves having a consistent wake up and go to bed time. Our sleep drive starts when we wake up, right when we put our feet on the ground. And it continues to develop throughout the day. Generally, we recommend to try to get into bed when you're feeling really sleepy. And if you don't fall asleep within 15 or 20 minutes, you want to get out of bed and go to a quiet area or do a soothing activity. It can help to set some pre-sleep relaxing routines, for example, listening to music or meditating, trying to avoid daytime napping because this intercepts the sleep-wake cycle. And when you wake up, try to get moving and into the light right away, rather than hitting your, the snooze, which is tempting to do. But if you can get up and get moving, that can get the brain awake. And then again, setting the sleep pattern that will last the day. We want to use caution with sleeping pills. Some sleeping medication can be habit forming or have troublesome effect. And ideally, if we do need to use sleeping pills, it would be for a short term. And while we're still really focusing on those sleep habits and lifestyle changes. So activity modification is another way to manage fatigue and pain. And here are some suggestions about how you might want to modify activity. So the first one, changing the method. And again, while I'm going through these, you might just want to think of those activities that are most challenging to you. I mentioned changing the method before when we talked about problem solving with fatigue, but you want to look at, for example, this changing the position, sitting to work for some tasks and standing for others. We want to look at are our postures helping us to distribute the weight, and also is our body position doing the best for us in terms of reducing force. So doing things like using two hands, maybe sliding things on a counter instead of lifting them, avoiding the prolonged gripping and holding. Sometimes we need to use a device to manage pain and fatigue, and that might include things like gait aids, like a walker or walking poles, but it also might include assisted devices, which I'll talk about in just a minute. And finally, braces. Braces can help support a joint for certain activities, and they can keep the joint in the right position. So for example, if you have a knee that is slightly out of alignment, a brace might bring it into better alignment, thus reducing pain, or compression, on your hands, on your knees, that also might intercept the pain signal. The last slide I want to talk about is assisted devices. And assisted devices can reduce the stress on the joint and make the task easier and help you save your spoons. And it's important to think about assisted devices as truly an aid and not something that is giving in or that you want to wait till the very last minute to use. So there's a picture there of a bed making aid. That's an aid that when you put it under the mattress, it lifts it up enough that might make it easier to tuck a fitted sheet around and take the strain off your hand and your back. A raised cushion by just a few inches can do a few things. It can help change the angle of your low back, and it can also make it easier to get up from the chair. A jar key, which is pictured there, is a little device that takes the seal or suction off a vacuum sealed jar. Therefore, your hand isn't squeezing on the lid. And you want to follow that up with using like a jar opener or non-slip material to then turn the jar off. And finally, a higher toilet, which might be just a higher toilet itself or a raised seat or a grab bar by the toilet. It's going to make it easier to get up from. So these devices are commonly available at medical supply stores and sometimes online. All right, now I'll pass it back to Sean.
Yeah, thanks so much, Krista. I love that spoon theory for energy management. That's great. Cynthia, do you have any final thoughts or recommendations for our viewers this evening?
Thanks, Sean. Yeah, I wish we had more time because there's a lot more we could delve into, but the highlighted strategies that you see on the slide are the ones that we spoke about today. So physical activity and exercise, fatigue management, activity modification, sleep strategies, etc. We did not have time to cover some of the other strategies that you might want to consider in consultation with your primary care provider. So this could be things like body-mind wellness. That might include cognitive behavioral therapy or mindfulness and meditation. Nutrition can also play a role in helping to manage symptoms. And lastly, there may be some medication options that you could discuss with your physician. Now, there are a lot of great resources available to you as well, but I want to highlight just a couple of them. The Fibromyalgia Association of Canada has lots of great resources on its website. Also, the Fibromyalgia Support Network, which is based out of London, Ontario, but offers virtual programming that is open to anyone in Ontario, even in Canada, and even internationally. They have some support groups as well as group-based programs and activities that can include things like a book club, chair yoga, gentle stretching classes, virtual games nights, etc. So lots of physical as well as social programming. And then the last resource I want to mention is an online learning module on fibromyalgia self-management from the Mayo Clinic. And we'll try to make sure that everybody gets these resources after today's session. And then last but not least, I just want to shamelessly plug our very own Arthritis Society Canada website, which is quite extensive and has a wealth of resources for you to navigate and live well with fibromyalgia. From our homepage, you can select support and resources from the top menu tab for lots of chronic pain self-management resources, fatigue management resources, self-advocacy resources. The list goes on and on. My other favorite section of the website is clicking on the Living Well tab from that top menu bar. And this takes you to Flourish, which has lots of short articles with tips and tricks for living well with arthritis or chronic pain, as the case may be. There's things like recipes, inspirational stories, life hacks, and more.
Hey, thank you so much, Kristen and Cynthia. I think what I'm going to do is jump into the questions that we received tonight, and obviously feel free to talk about the future and what you're excited about in that context. But with that, I think I'm just going to get started with the Q&A, if that's okay. So first question, maybe for you, Cynthia. It's a bit of a chicken and egg kind of question. So do people with arthritis develop fibromyalgia, or does the fibromyalgia lead to more arthritis?
Oh, what a great question. I love that one. So I think it's important that at this stage of the game, there's no causal relationship. It's an association between the two things. So fibromyalgia does not cause arthritis, certainly, but it is more common to have those two conditions together. The tricky part is that when you have arthritis or really any type of chronic pain, that can lead to that sort of sensitization and ramping up of those pain amplification signals that can then lead to fibromyalgia. So as I say, it's not a direct cause necessarily, but definitely an association between the two.
Okay. Kristen, there's a question here about how does somebody talk about their pain with their rheumatologist or with a physician, and how to determine if the pain is caused by fibromyalgia or if it's something different?
Yeah, that's a really good question too. So my experience in working with others who have tried to engage a medical system regarding their pain is it's best to come in with facts and numbers and data. So for example, you might want to say something like, my pain has been 8 out of 10 for the last 3 months in these areas of my body. And just try to be as descriptive in terms of the quality of pain, the location of pain. And in describing that, you might also want to just ask the physician whether or not other conditions could possibly cause your symptoms. And if the answer was no, then you'd want to talk a little bit more about potential diagnosis. And so a family doctor can diagnose fibromyalgia. It doesn't have to go to a rheumatologist. The rheumatologist might see people if there was question about other types of arthritis, such as an inflammatory arthritis. You could also explore options with your healthcare provider about things such as pain clinics. And oftentimes these are funded clinics that are specialized in dealing with pain and that may have trained physicians that sometimes include physiatrists, which are doctors that specialize in pain medication, in pain treatment and management. And so all of those things together might help you get diagnosed and get the help that you need.
Thanks, Kristen. Cynthia, I'm going to build on that a little bit. And Kristen covered a lot there. But question here about how do you, if somebody has rheumatoid arthritis, how would you know if you also have fibromyalgia? Because both of the conditions have similar symptoms sometimes.
Yeah, for sure. There's definitely overlapping symptoms, as we've learned, right? There's the pain, the fatigue, but there's also some differences between the symptoms as well. And so, as Kristen said, the clearer you can be with your physician about your symptoms, the more clues they may get from that. And so really it's going to be a combination of what you're reporting to them, but also their physical examination. So there are going to be some differences when they do that exam in the office in terms of what they're looking for. So they're going to be looking for swollen joints or signs of joint inflammation versus signs of more widespread pain outside of the joints. So that would be a big difference between the two. They're also going to look at your diagnostics, so your blood work, for instance. And are there markers of inflammation in your blood work? And if you have rheumatoid arthritis, you've likely had some positive markers at different, some points in time. But sometimes those markers, as the inflammation levels come under control with medication, those markers lower and come down. And if your pain level isn't following suit, sometimes that's a bit of a clue that maybe there's something else contributing to your pain outside of that inflammation. So they might use your blood work as an example. And they might also use other things like your x-rays and ultrasound of your joints to help determine if there's some active inflammation going on in those joints, which would be from rheumatoid arthritis, and you would not see that typically in fibromyalgia. So there's definitely, as you say, a lot of overlapping symptoms and similarities, but then there's also a lot of differences that your physician will be able to pick up on. And basically it's putting all of those puzzle pieces together to come up with that diagnosis. Sometimes initially the waters are a bit muddy and it's not exactly clear what's going on. And then the picture sometimes becomes a little bit clearer over time. So you sometimes have to be a little bit patient because there isn't, one exact test that can diagnose these conditions. It's really a series and a combination of things. So it does take a little bit of time in some cases to figure it all out and put all of those pieces together.
Thanks, Cynthia. I'm going to ping pong back to you, Kristen, because you're both so well to these questions. But again, building on that, in terms of the pharmaceutical management of fibromyalgia with arthritis, are there different medications that people would be recommended to take for the two conditions?
So right now, there's only two medications that Health Canada has approved for the treatment of fibromyalgia. The first one is pregabalin or Lyrica, and that's an anticonvulsant medication that helps cool down the nervous system. And it kind of works like a dimmer switch on a light bulb. It turns down the pain signal. Now, Lyrica can have some troublesome side effects, which could involve sleepiness, which might be okay if you need it to help you sleep, but could be a problem, for example, during the day. Duloxetine, or the trade name Cymbalta, is the other medication, which is actually a pain modulating antidepressant. And it is a serotonin norepinephrine reuptake inhibitor, or SNRI, which does have an impact on pain and can also boost the body's natural ability to deal with the pain signal. Now, sometimes physicians will prescribe muscle relaxants, especially if people are having muscle spasm that might be interfering with their sleep. Sometimes analgesics, like, for example, acetaminophen or non-steroidal anti-inflammatories are prescribed, especially in context of like nociceptive pain. The Canadian fibromyalgia guidelines actually recommend a trial of medical cannabis in the context when the other strategies that we talked about today aren't working, and there might be sleep issues as well. And there is a lot of great information on our website about medical cannabis as well. Opioid medications should be avoided in general because it's found that not only are they potentially habit forming, but they aren't particularly effective for people with fibro. And finally, I want to talk about some medications that are currently newer to the use of fibro and chronic pain treatment. And one of them is low-dose naltrexone. And naltrexone is a drug that in a normal dose blocks the impact of opioid medication. So it's actually used for people withdrawing from opioids, but in lower doses they found, and one of the benefits is actually pain management. Now, not every physician will prescribe low-dose naltrexone. You sometimes need to speak to a pain specialist to have that prescribed. And finally, there is some very new research and not commonly prescribed on the drug ketamine, which I don't know a lot about, but we know that it's currently being looked at as another potential newer drug that could help with fibromyalgia.
Okay, thanks, Kristen. I think maybe I'll stay with you for this next question too, actually.
Okay.
If somebody suspects that they have fibromyalgia,
Yeah.
what kind of healthcare providers should they be going to confirm or not a diagnosis?
Mm-hmm. Yeah, so as I was mentioning before, you don't have to see a rheumatologist to be diagnosed with fibro. In fact, the guidelines recommend that the general practitioner or your primary healthcare practitioner be able to diagnose fibromyalgia. Now, there's many physicians that may not be familiar with the new criteria of diagnosis, so it always is good to be informed. And you can find that criteria pretty readily available online, and ask the doctor, could they do an assessment with you to formally diagnose it?
Thank you. Cynthia, I'm going to ask you here, people have certain symptoms that they're wondering if they could be related to fibromyalgia. So in particular, somebody's asking about back spasms, whether that's ever affiliated with fibromyalgia, or weak knees, weak legs, tired legs. I don't know if you can comment on either of those things.
Yeah, definitely. So back spasms, for sure, that could be a symptom of fibromyalgia, absolutely. It could also be a symptom of a whole lot of other things as well. So really, muscle spasms or back muscle spasms, it's your body's way of protecting itself. So usually if there's pain in a certain area, you'll often get muscle spasm as a way to kind of protect that area from the pain. The other time might be if your body kind of senses that it needs to protect itself from an injury or some kind of harm. It may also kind of spasm as a protective mechanism there as well. So certainly that may be the case in fibromyalgia, but it could be occurring for any number of other reasons as well. And so it would be important to maybe speak with your doctor or healthcare provider about that to make sure that you're ruling out other sources of that muscle spasm. The treatment, no matter what the source is, of course, you're going to try to get to the root of the problem, but to treat that spasm itself, you can do things like heat or ice. Either one can be helpful. It really depends on the individual, and you can go with whichever one feels better to you. Gentle stretching is usually helpful, nothing forceful, but very gentle movement, gentle stretching. Long-term strategies, we often recommend strengthening those muscles. And if you build up that muscle strength and that muscle tolerance for movement, then usually that does help to prevent some of the muscle spasm down the road as well. And there could be breathing exercises. I forgot those. That's one of my favorite ways to help muscle spasms. So we talked about in the presentation how breathing can really calm down the nervous system. So when it's in overdrive and trying to protect things, we need to really calm it down. So the deep breathing can be especially helpful during those episodes of spasm. And then there can be medications that may help as well. So again, there's a wide variety of things that your doctor might advise you to take, from anything from analgesics like Tylenol to anti-inflammatories to muscle relaxers or others. The other one, the weak legs, again, that could absolutely be, you know, a symptom that somebody might experience with fibromyalgia. We know that fatigue is really common. And so we might notice that, yeah, I can't walk for as long as I used to, or climbing stairs is becoming really difficult. And you know, I don't have the ability to do that the way I used to. And again, it could be the fibromyalgia, but it could also be a lot of other things. So I would definitely want you to speak with your primary care provider about that particular symptom, just to make sure that any other things are getting ruled out. And again, I won't go into the long laundry list of things it could be, but there's a whole lot of other reasons why that may happen. So.
Thanks, Cynthia. Okay, Kristen, we have somebody here who was diagnosed with fibromyalgia pretty young, in their 30s. So really relates to, are there specific supports or recommendations that you would have for somebody in that situation who's been diagnosed pretty early on in life?
Yes, that is uncommon, but it does happen, and kind of represents a whole other layer of its own unique concerns. Unfortunately, I don't know of a specific support for younger people with fibro, but I do know that some of the resources that Cynthia mentioned, and I know specifically about the Fibromyalgia Support Network that originated in London, Ontario. They're quite a large group, and I'd be pretty confident that there would be younger people represented in that group as well. And I would also just want to encourage a younger person with fibro, because it is unique, to reach out to mental health supports as needed, whether it's through family health provider, for example, or other specific supports targeted towards youth. There is the book that the Fibromyalgia Support Network put out, called 50 Shades of Fibromyalgia. There are a few stories in that book about people that are younger that have fibro, so that might be interesting to read as well.
Hey, and I think last question to you, Kristen, an important one. Is there a cure for fibromyalgia?
Right, that's a really is an important question. Right now, there is not a cure that I'm aware of. Fibromyalgia is often chronic, but it is managed and can be managed well. And I've seen this in my own practice, really through that combination of support. I want to say support almost number one, so you know that you're not alone with it, but then also through the self-management strategies that we talked about, and then also through potentially medication management. And my experience with fibro is it really needs to be self-care focused. Like, it's so easy for us to not put ourselves first, but with fibro, it's very important that we do that, and maybe look inward to reach, you know, look at those areas that we need help with, ask for help. And, you know, even though it isn't a cure, it's not something that can be cured. It is something that you can still have a good quality of life with.
Very good insight. So Cynthia, Kristen, thank you so much for everything this evening. That just flew by, that hour. Before we go, we'd like to take a few moments just to get the audience's feedback on today's presentation. So for those of you who are joining us live on Zoom, you should see a question pop up on your screen. So click on the response that reflects your thoughts about feeling more knowledgeable and empowered after attending this webinar. We will also be sending you an evaluation form after this session, which will email you along with the recording of the slides. So if you weren't able to access the poll question just now, you'll have the opportunity to give feedback at that time. And we really, really do use the survey feedback to shape our Arthritis Talks series. So please do take a moment to give us your feedback. And we'll be back again on June 25th for another Arthritis Talks focused on preparing for joint surgery. So once again, we are very grateful to Pfizer and others for their financial support of this event. With that, this concludes our Arthritis Talks. On behalf of all of us, thank you for joining us today, and please stay well.